Currently, Nigeria is experiencing an upsurge in the occurrence of Lassa fever. Across the country, there is an outbreak. Let it be known to everyone that Lassa fever is with us as we speak. Lassa fever is a very dangerous disease caused by Lassa virus. And Lassa virus is transmitted through a rodent we call Mastomys natalensis. Mastomys natalensis is a special breed of rat that is found in Nigeria and some parts of West African sub-region. What are the symptoms of this Lassa fever virus infection? The symptoms are not as clear. It's not something very categoric. It resembles every other illness. So there could be headache, there could be chest pain, there could be cough, there could be vomiting, there could be diarrhea, there could be vomiting of blood from the nose, eyes, ears, even through the birth canal. There could be bleeding from there. So what to do as an individual is to have high index of suspicion. You should be very suspicious if you notice that, look, you are unnecessarily tired, you have cough, you have catarrh, you have headache, you unnecessarily, you bleed from the nose, from the mouth. You should have high index of suspicion. It should make you want to go to the hospital. What should we do? It is basically a disease of hygiene. In tribes where there is poor hygiene. So what should we as individuals do? We encourage us to be very hygienic, starting from our homes. It's very expedient for us to keep our homes clean, for us to keep our environments clean. Because if we keep our homes clean, for instance, tidying up the floor, tidying up the kitchen, tidying up our plates, keeping the environment clean, it will discourage the proliferation of these rodents. Also, if we have garbages here and there, we should dispose our garbages away from home. Because if we do not dispose garbage away from home, it will constitute a breeding ground for proliferation of this said rodent that is implicated in the causation of this Lassa fever. What else should we do? We should practice good hand hygiene, learn to wash our hands with clean water and soap. And where we don't have clean water and soap, we can use hand sanitizers. Alcohol-based hand sanitizers can be deployed to keep our hands tidy. Also, we can practice good food safe practices. We should cook our food very well before we eat it. Avoid mixing raw food with cooked food because it may be at risk of being infected, contaminated. So, having cooked the food, it is expedient for us to eat the food immediately. After cooking, we advise people to eat the food immediately. And if you must store the food must be properly stored in a well-sealed container that will avoid contamination. Okay? So that's one of the strategies to prevent Lassa fever outbreak, as it were. Now, for those who work in the hospital setting, we discovered that the hospital instruments like artery faucets, tables, or formats can be infected by feces or urine from this rodent. So there is every chance that the hospital staff are at risk too of being infected. Also, those humans who are affected, their body fluid, blood and body fluids like saliva, urine are also exposed to this infection and they can constitute a means of transmission. So we encourage hospital staff to be very, very cautious in the delivery of their services. While delivering service, it is important to stay safe because you cannot deliver what you do not have. A healthy person should be the one standing between the people who are sick and those who are healthy. So how do we stay safe? We stay safe by using personal protective devices. We need to use our boots, our goggles, our face masks in the course of discharging service. And for every patient that is suspected of having Lassa fever, we should treat such patients with standard operating procedures and maintaining high infection prevention control measures to ensure we don't get contaminated. The effort is to ensure that we stay safe. Like I said earlier, it is a very deadly disease. It causes a barrage of symptoms, and these symptoms are not classical symptoms because they resemble symptoms of other illnesses. So that's why it is important for us to come to the consciousness of the fact that, look, there is an outbreak and we need to do something about it as health staff. We need to stay safe to be able to preach to others. Thank you very much.
Thank you.